And here is a look, meanwhile, at the latest numbers from both Kansas and Missouri when it comes to the coronavirus. In Kansas, the health department reported more than 4,600 cases since Monday. That brings the total to more than 162,000 since the outbreak started, and there have been close to 1,700 deaths in Kansas. In Missouri, the state reported almost 2,700 new confirmed cases on Wednesday. That brings the total to more than 305,000 cases since the pandemic started. There have been more than 4,000 deaths. In Missouri, Governor Mike Parson said Wednesday that help is on the way for hospitals in the Show Me State. Governor Parson says he is hiring Vizient, a medical staff placement company, to bring up to 760 nurses, respiratory therapists, and certified nurse assistants to Missouri. Governor Parson says the CARES Act money will be used to pay for the program that will last for 12 weeks. And the Kansas Health Department plans to follow the CDC's new quarantine recommendation. There are two options. The first is to end quarantine after 10 days if no symptoms are reported. The other is a 7-day quarantine if a person tests negative and has no symptoms. However, people are still urged to monitor symptoms for a full 14 days after exposure. Well, the state of Kansas expects to receive the first shipment of the COVID-19 vaccine sometime this month. Governor Laura Kelly announced Wednesday that once a vaccine is approved, about 24,000 doses will be available from Pfizer. Moderna is expected to ship 49,000 doses. In total, Kansas will have 150,000 doses by the end of December.
With this schedule, we intend to protect the greatest number of Kansans, foster economic recovery, and get our kids back into our school buildings as quickly and safely as possible.
Well, distribution begins with healthcare workers in nursing homes in phase 1. And the Pfizer vaccine is now cleared for emergency use in the United Kingdom. That means that people could be getting the vaccine in just days. For the United States, the FDA will consider Pfizer's application for an emergency use authorization on December 10th. December 17th, the FDA will consider Moderna's vaccine candidate. Experts say, though, it may be the spring before vaccines are widely available in the U.S. And once a COVID vaccine arrives, researchers will have a new way to track any side effects people are having. As many as 40 million doses of the vaccine are expected to be given to healthcare workers and people in long-term care facilities in the first phase. At the University of Kansas Health Center, medical staff getting the vaccine may be asked to track symptoms using an app on their phones. Well, that way researchers will know in real time if there's a problem.
And so while we are confident, or hopefully confident, that the vaccines are going to be both effective and safe, we don't have all the data yet. I think that's a great idea that people can submit right off their cell phones what side effects they're having. So you're not relying on physicians to fill out those long, laborious forms that we get every time you put a patient on a drug. And you stop it on your phone. That'll be great.
Well, there's a chance that those first doses could be given in a couple of weeks. Well, 3 former presidents say that they will get the COVID-19 vaccine. Presidents Obama, George W. Bush, and Clinton all are agreeing to get the vaccine on camera to promote its safety as well as encourage others to get the vaccine. Many experts believe the FDA is getting very close to approving one or more vaccines. Good morning, everybody. And coronavirus warnings across the country are getting more urgent. This comes as the U.S. set a pair of grim records. ABC's Faith Abube has a closer look.
The latest metrics for the coronavirus in the U.S. all pointing the wrong way this morning. New infections of COVID-19 at an all-time high. Hospitalizations and the death toll reaching levels this country hasn't seen since April. The CDC now warning 200,000 more Americans could die from the virus within the next 3 months.
December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
The potential impact on an already taxed healthcare system worrying officials coast to coast. ICUs near capacity in New Mexico, North Dakota, and Rhode Island. Some hospitals in New York and Virginia suspending elective surgeries as COVID symptoms send a record 100,000 Americans to hospitals across the country.
We're very concerned at the number of cases that were present today, and I don't even think that that represents the Thanksgiving holiday.
The White House task force saying America is in a dangerous place, adding those 65 and older should not enter any indoor public areas where anyone is unmasked.
Is a very risky situation.
The grim development coinciding with hopeful news on the vaccine front. Health officials in the UK authorizing the world's first COVID-19 vaccine. The U.S. not far behind. Officials expecting the Pfizer vaccine to be available here starting December 15th.
It's just making sure that we have everything locked so when EUA decision comes, distribution to the American people becomes immediate within 24 hours.
And Dr. Anthony Fauci says the U.S. could be close to normal by next summer if 70% of Americans get vaccinated. Meanwhile, students in the Kansas City, Missouri district remain in distance learning, but Genesis Charter Schools offer in-person learning full-time. Of course, school looks different at Genesis. There are temperature checks at the door, and then students follow the arrows to their classrooms. And you see there, their desks are divided by protective barriers.
We want to be able to be a part of, closing that gap, combating learning loss, and still making sure that we are meeting their social emotional needs.
Well, the superintendent, though, says things have not been easy. Quarantines have left educators taking on more responsibilities. And we are closely following developments in the coronavirus situation around our area, the country, and the world. For updates on cases, testing, and vaccines, just visit our website, kmbc.com, or download our free app.